Good afternoon. Firstly, thank you very much for inviting me to speak to you today about the general surgery training in the UK. My name is Munir Tarazi, and I'm an ST7 in upper GI and general surgery in the UK. So, to start off with, I'm going to talk about why choose the UK for training, about the UK surgical training pathway, and then how and when to apply for training. So to start off with, why train in the UK? So firstly, in terms of work conditions, there's a good income generally. So you have a good salary that you get monthly, and you also have the opportunity of topping up your salary with what we call locum shifts, which are extra shifts you do during your training. It offers a good work-life balance. You generally don't do on calls more than 12 hours in a row as a resident doctor. And if you get on the training pathway and you'll be in the UK for, let's say, 6 to 8 years, you have a guaranteed nationality at the end of your training. In terms of the training pathway, it's a good structured and standardized training pathway nationally. It offers you prestigious qualifications that are recognized globally wherever you'd like to work, following up on from your training. And during your training, there's a bit of flexibility during it. So you have the opportunity of doing extracurricular activities during it, as you can get involved in teaching, in leadership, and in research. You have the option of doing a master's or a PhD during your training. And you have access to cutting edge research and innovation that's offered in the UK. In terms of living conditions, there's a very diverse community, especially a big Arab community generally throughout the UK. So you have that around for support. And it's not too far from Jordan. There are direct flights that you can take from around the UK to Jordan. So talking a bit more about the UK surgical training pathway. So generally after medical school, in the UK, people apply for what's called the foundation program. So when you initially graduate medical school without an internship, you have a provisional license to practice. So you go into this 2-year program. In your first year, FY1, this is what's equivalent to internship across the world. And once you complete your FY1, you have a full license to practice. Generally, across the foundation program over the 2 years, you get 4-month rotations in different specialties, and that will be a combination of surgical specialties, medical specialties, psychiatry, GP, A&E, etc. Your FY2 is equivalent to a SHO job, if you've heard of that. And there is an option to apply directly to a standalone FY2 post, but we'll get to that later. So once you complete your foundation program, or an equivalent of it, you are allowed to apply for the UK training pathway. So the first phase of the training is what's called the core surgical training. And this is a 2-year training program where you get 6-month rotations in different surgical specialties. Again, this is specified to surgery, but not to general surgery. So during that, you might do 6 months of cardiothoracics, plastics, orthopedics, general surgery, etc. Once you complete your phase 1 or your core surgical training over these 2 years, you have the opportunity to apply for the specialist training, which is what's called phase 2 training. So this phase 2 training would be in general surgery specifically, and during it, things have changed, a competency-based system where you have to meet certain competencies to progress. So this generally takes around 4 years, but if you end up coming to the UK later on after doing a few years of training in Jordan, this can be brought down to less than 4 years. And during these 4 years, your aim is to do an elective general surgery job, including emergency general surgery, elective gastrointestinal surgery, and at least one of other subspecialties. So you have the opportunity of doing breast surgery, transplant surgery, endocrine surgery, vascular, trauma, general surgery of childhood, remote and rural surgery, colorectal and upper GI surgery. And that takes roughly around 4 years. Once you've reached your competencies for sign-off from phase 2, you progress on to phase 3, which is your subspecialist training. During this, it generally takes around 2 years. You have the opportunity of doing the FRCS exam, and at the end of it, you achieve completion of specialist training, or CCT. And you go on to the specialist register. So generally, this is what the pathway looks like. Phase 1 is the core surgical training. Phase 2 is where you do 4 years to reach the level of a day 1 consultant in elective and emergency general surgery. And then your last 2 years, your phase 3, is where you do your subspecialist training and then complete your training in one of these options, which is emergency general surgery with, let's say, colorectal or esophagogastric, hepatobiliary, transplant, breast, any of these subspecialties. So how the training structure in the UK is based on a multi-professional team. So this is led by the School of Surgery and the postgraduate dean who overlook the training. But directly from your point of view, you have the program director who will meet you every 6 months to ensure that you're progressing well in your training and you're meeting your competencies. And during each placement, you're assigned an educational supervisor and a clinical supervisor who will work directly with you as the trainee to ensure you are meeting competencies and getting the training you need. The assessments are based on 4 domains. So it looks at specialty-based knowledge, clinical skills and judgment, technical and operative skills, professional and leadership skills. And throughout your training, these all 4 aspects are focused on in terms of courses, in terms of teaching, to build these foundations from your foundation program all the way to your subspecialist training. And these are assessed as you progress through the system. And your assessment system is based on multiple aspects that they look at every 6 months, and that would be your learning agreements during your placement, your educational supervisor report, you sign off different workplace-based assessments, and your logbook during your training, which you get very familiar with when you're in training. There are certain mandatory courses you have to do, and you have the opportunity of doing other courses. And you have a 6-monthly annual review of competence progression, which is your ARCP. And of course, during your training, you have to complete your MRCS examination during your phase 1 core surgical training, and then the FRCS examination during your subspecialist training. So generally, during your placement, this is what things look like. You have a 6-monthly assessment during the placement. So when you start your placement, you have a learning agreement and objective setting meeting with your educational supervisor. And then you have a midpoint multi-consultant report that's done, and that's assessed during your midpoint review with your educational supervisor. And then at the end of your placement, you have another meeting and another multi-consultant report to ensure you're progressing and meeting your competencies. So let's go on to how to apply to the UK. So the first thing you need to be able to apply to the UK is a GMC registration, which is the General Medical Council. And there's 2 ways to really achieve that from Jordan. One way is to do the PLAB exams, or secondly, if you are sure you want to do surgery, then the MRCS exam is an option, because you'll need that anyways during your training, and you have the opportunity to do that to get your GMC registration rather than having to spend more money on different exams. And of course, if you're interested in any other specialties, you have the MRCP, the MRCOG, different exams for different specialties that you can use to get your GMC registration. Once you pass these exams and get your GMC registration, that's when your journey really truly begins. There are other things that you need to apply for GMC registration, and that's all found online. So you will need your primary medical degree, an English proficiency exam, either the IELTS or the OET. Generally, the OET is easier to pass and easier to get through, so that would be the recommended option. You need proof of clinical knowledge, an acceptable internship to get your full registration, your activities for the last 5 years, and a certificate of good standing. And as I said, you can either do the PLAB exam or a postgraduate qualification, such as the MRCS, to get them. So generally, in terms of costs that you'd need, if you want to do the PLAB exams, the OET or the IELTS English test, you can do that in Jordan, and it costs roughly around 300 dinars. The PLAB 1 is a theoretical exam. It's around 180 multiple choice questions, and you can do that either in Egypt or in Dubai. And that's roughly around 300 dinars and needs around 3 months of prep. The PLAB 2 exam is a clinical OSCE that has to be done in the UK in Manchester and consists of 16 stations, and it costs around £1,000. So it is quite costly to start the process. And especially if you want to top it up with a course for practice for this, it'll cost around £400 to £500. And that's why doing a membership exam might be a better option, because either way you're going to have to pay for those exams, so you might as well do them early. After you get your GMC registration and you have your full registration with license to practice, really you have two options to come to the UK. One is to apply for a standalone FY2 position, which is competitive and limited, because generally there are spaces that have opened up from people who have not progressed from FY1, or applying directly for a non-training SHO or trust grade position. The non-training SHO position is not counted towards the training years. It is similar to the transitional year at King Hussein Cancer Centre and can be in any specialty of your interest. It is very good because you get NHS experience and you can use that to build your portfolio and your practice for your interviews that will be coming up. You'll be involved in ward cover, surgical procedures, clinics, and opportunities for audits, quality improvement projects, and research and teaching activities that you need to build up your portfolio. The training jobs, their application opens through a website called Oriel, and that's in November every year. You'll be invited to do a multi-specialty recruitment assessment exam, which you can do in Jordan if you're applying from Jordan, or you can do in the UK if you're already here on a standalone position. This is 90 clinical questions and 50 ethical questions. And the score is used to shortlist you for interviews. So there are around 1,200 positions for 5,000 applicants. Once you're shortlisted, after the interview, results are used to rank candidates. And basically your ranking after the interview, 10% comes from your MSRA result, 30% is from your portfolio assessment, and 60% is on your performance during the interview. You can use this website to do a self-assessment on what you already have or what you might need to achieve full marks in core surgical training when you're applying for it. Thank you very much for having me. I know this has been a whistle-stop tour of the UK pathway, but if you have any questions or you'd like to speak to me about any advice, please drop me an email or get in touch on social media. Thank you very much.